Good morning, everyone, and welcome to another episode of Healing Our Communities. I'm your host, Heather McDaniel, Vice President of the West Virginia Drug Intervention Institute. And today I have an extremely special guest with us who, more often than not, is sitting where I'm sitting, our president of the Institute, Dr. Susan Bissett. Welcome, Susan, in the opposite seat.
Thank you, Heather. I get to be in the hot seat
That's
today.
right. I am so honored to have you as a guest on the show and talk about all of the work the Institute has accomplished, their big anniversary that's coming up, and some upcoming events. So for those out there who may not know you or know a lot about you, let's let them get to know you a little bit and your role at the Institute and how you ended up there from where you were. Can you just share a little bit about you outside of the work you do, just your background and a little bit personally about you?
Yeah, so I actually was in higher education for 26 years, primarily in student affairs, but also did some teaching, was an assistant professor, and I held various roles in different places. So from director to assistant dean to dean of students, a vice president at one point, and then most recently, before I took on this role, I was the assistant dean at the University of Charleston School of Pharmacy. So really thought that I was going to be originally a college professor when I was in school, but then really had the goal of being a college president and never thought that I would be the president in a CEO role with a nonprofit organization. But I think it was kind of a natural progression for me because when I was at UC, I was working with pharmacy students on professional development. And so one of the things that I was assisting with was programs that put pharmacy students in the community, educating the community about medication and medication adherence and the risk of opioid use and abuse. And so was doing outreach in schools in Kanawha, Putnam County, talking to young persons about the dangers of sharing prescription medications and talking to trusted adults if they were taking medication. And so in 2019, when this role became available, I saw it and I said, this is a perfect fit for me. And I've always kind of considered myself a builder of sorts. Like I like the challenge of taking something that's the seed of an idea and really turning it into something. And, of course, I haven't done that alone in the last 5 years. We've put a lot of people in the right seats on the bus to make it happen. We have a fantastic staff and a fantastic board. But what we've been able to accomplish over the last 5 years with the Institute has just been phenomenal. And I would have never imagined, if you would have asked me 5 years ago, sitting in this seat, if I could look back and say we've accomplished everything we've accomplished, I don't think I would believe you.
Right. Yeah, there's a lot, and we are definitely going to talk about that because there's been so much that's happened at the Institute, and it's still growing exponentially.
Definitely.
So you've been the president at the Institute since day one, since it started. Can you tell us a little bit about how it was created? Because it kind of tied into your role at the University of Charleston.
Absolutely. So the Institute was really birthed through the University of Charleston, which sounds kind of a weird analogy, but it truly was. That's where it started its infancy. And so at the time, the president of the university, Dr. Ed Welch, who also sat on the board for BB&T, which is now Truist, had a very good relationship with that organization. And their chair at the time was very interested in helping to address the opioid crisis, particularly in West Virginia. And of course, BB&T, now Truist, was particularly interested in how do we build a healthier workforce. Mm-hmm. And so through a very generous donation through the Winston-Salem Foundation, they were able to start the Institute. And that gift prompted several months of deliberative study on the part of Dr. Welch and other members of the board to kind of determine which direction they wanted to take with the Institute. And a decision was made that the focus would be primarily on prevention and education. And so the position became available in spring of 2019, and by May 1st, I had taken on the role of president of the Institute and was the very first employee, had no staff when I started. I think actually my first office was in a back corner of the pharmacy at the University of Charleston School of Pharmacy. So the fact that now we're on Capitol Street and we're well known not only in West Virginia but outside of West Virginia is pretty phenomenal over 5 years. But Truist definitely had a substantial role in creating the Institute and was really the first funder of our work.
Absolutely. And so can you tell us a little bit about opportunities you've been given as part of this role? Because I know I see it and see you everywhere and doing all kinds of exciting things, but can you talk a little bit about those opportunities that have presented themselves because of the role you have at the Institute?
Yeah, it's really weird to me to be recognized publicly by people I don't know. I've told a story to the staff and friends of mine that, you know, I was doing some work with WSAZ and was on one of their programs talking about medication safety and the one box and don't keep Rex around. And I was driving downtown on the way home and the window was down and this little old man on the side of the road goes, "Hey, Dr. Susan." And I was like, I don't know who this person is or how they, but it's good in some ways because I feel like people trust me and they'll come to me and they'll come to the team to ask for expert advice on drug take-back or medication safety or prevention programming or naloxone distribution and education. And more importantly, how do we reduce stigma around this issue? And so for me, the opportunity has been to really be a part of the community in a very meaningful way. Not that I wasn't part of the community before. I had been involved with many different civic organizations in different roles, but I really feel like I've had the opportunity to have a voice and be part of the conversation, whether that's sitting on subcommittees for the Governor's Council on substance abuse, whether that's going and doing a panel with national leaders on the topic in Washington, D.C. or Kentucky or Florida. And so I feel a huge responsibility, though, for those opportunities because especially when I leave the state, I feel like I'm also representing the state, right? So we talk a lot about how West Virginia is ground zero for the opioid epidemic, and we tend to listen to the news and they talk about how bad it is. And so I feel a huge responsibility when I'm talking about this outside of the state to also talk about the fact, and I'm going to borrow from Mayor Steve Williams in Huntington, that we are the center of solutions here too. That West Virginia has some phenomenal things that are happening that can be models for other parts of the country on how to address some of these issues.
Absolutely, and we've seen that just with what we do, other states reaching out to see how they can do the same. So what would your advice be to someone who wants to get involved in the type of work that the Institute does? Let's say they're fresh out of college or maybe not, and they're just interested in what we do. What would be your advice to them?
Well, that's a tough question because I came to this work, and I won't say accidentally because I believe in happy accidents and serendipity, but I don't think anything is truly an accident. And so I sort of feel like, you know, if you believe in a higher power, that the path has taken me this way, you know, starting out wanting to be a college president and be on a university campus to taking on this role. This is very meaningful work, but it's also very hard work. And so the advice that I would have to young persons who want to do this work is spend more time listening, at least in the first part of your career, because it has to be a space where people feel heard. And there are so many people that have a vested interest in this work. I mean, there's healthcare providers. I think about folks like Dr. Sidney McElroy, Bob Whitler. I think about Dr. Sherry Young. I think about Jan Rader and their perspectives as healthcare providers and in many ways first responders. And then I think about families who have lost loved ones. You know, I think about Cece Brown and her family. I think about people who are in long-term recovery, like our friend Joanna Vance, who's a great friend to the Institute. And their voices are really important in this work because I can't do this work. None of us can in a vacuum. No one person or one organization can tackle, we talk about eating the elephant one bite at a time. It's a big elephant, and so it's going to take a lot of us to be able to address the issue. And so if you're coming into this work, I think spending a lot of time listening to different perspectives, because they do vary sometimes, but I'm not a person in long-term recovery, and so I feel real responsible for listening to the voices of people who are in recovery, of talking to them about their perspectives and how things are presented, how educational programs and outreach is presented. I think that's really, really important. So I can't emphasize enough the listening piece. It's just crucial.
I think that's fantastic advice. Just from working in this field for so long, I think more people should heed that advice. And we mentioned that the Institute is about to celebrate 5 years as an organization, which is fantastic. And congratulations to you, because you've been there literally since day one. What are you most proud of that the Institute has accomplished? And can you talk a little bit about all of the accomplishments, because there are quite a few?
Well, you're being very humble because you're a part of this, and I think one of the best things I did was hire you. And you came to us from the helpline and the quit line, and I think that perspective has really helped us to grow and think about how we present things and how we do outreach to people. So I want to thank you for that. I think part of our success has been having a lot of really smart people in seats at the right time. And, just like any team, sometimes staff transitions out and you're happy for them because they've moved on to do bigger and better things, but those individuals have still left a footprint on where we are now. And so I'm very proud of all of the folks that have worked for us and those that continue to work for us. So I think having the right team is crucial. The other thing that I would say is I think collaboration and partnerships are key. We have a very, very strong partnership with the Office of Drug Control Policy. We have a very strong partnership with the folks that coordinate the state opioid response funding. That is in large part because you came from that environment and have that relationship. We have a very strong relationship with the Appalachian Regional Commission and have received some funding from them to expand the recovery workforce. We have a great relationship with Jobs and Hope. I mean, when we started the Institute, we had no one in long-term recovery working for us, and now really with the ARC grant, the majority of our staff is now in long-term recovery. And so having that perspective is so, so important. I think we've had collaborations with, Aetna Better Health of West Virginia, with the Vandalia Health Network. Those have been the West Virginia Primary Care Association. Those have been crucial into getting naloxone in 1 boxes throughout the state. We've had a great relationship with Susie Mullins and the West Virginia Collegiate Recovery Network, and in fact they are now doing the bulk of the college programming that we started because it was a natural transition point to them because they have a footprint on the state's college campuses. And then we've been fortunate enough to have a partnership with Joe Murphy. And Joe created Rex before the Institute was even established. And we were fortunate enough to bring Rex with us and expand our footprint with Rex. Initially, we were doing medication safety education in Kanawha and Putnam County. Now we're in 30+ counties. We're reaching 40,000 families with that messaging. You now have a partnership with Grand Families. We're talking to national partners, including West Virginia Public Broadcasting, about putting some of that curriculum on a national learning platform. So that partnership has been key. And then, Joe also developed the 1 box. And the 1 box is something that I don't think Joe or you or I or anyone thought it was going to be nationwide. We were trying to solve the problem of getting naloxone and training on West Virginia college campuses. And now we have naloxone in 1 boxes on every college campus in West Virginia. But we never imagined we'd have 15,000 of these boxes deployed in 50 states and 3 countries and growing. I mean, we got more orders yesterday for boxes. So that partnership has been really key in his creativity. He's an idea guy.
Yes.
So his creativity has been essential, and we've been able to take some of those ideas and really build upon them and create some meaningful programs as a result of them. So, collaboration and partnerships has truly been, we haven't done this in a vacuum.
Agreed.
We can't take all the credit for everything that's happened over the last 5 years. It's happened through collaborations and partnerships. It's happened through support of mayors like Amy Goodwin and Steve Williams. It's happened with support of national leaders at the National Office of Drug Control Policy, of attorney generals in other states. And so we've just been very, very blessed. I mean, I think part of this work is relationship building, and we've built some really, really strong relationships.
And I think you're being humble because this has all happened under your leadership, and you do a fantastic job every day and work so, so hard. I see it firsthand. So we're going to take a quick break, and then we'll come back and we'll continue chatting with Dr. Susan Bissett, the president of the West Virginia Drug Intervention Institute.
Hey, Grandma Peg, what you doing?
Oh, hi, Rex. Well, you remember little Maddie, right? My granddaughter? She's on her way over to spend the afternoon with me.
What about these medicine bottles and pills, Grandma Peg? Those could be really dangerous with sweet little Maddie around. You remember what to do, right?
Oh, of course I do, Rex. I was just getting ready to put these away.
Folks, we never mess around when it comes to medicine. All medication should be kept in a safe cabinet or a high shelf, out of reach of children. Don't keep old Rex around.
Welcome back, everyone, to Healing Our Communities. And as I mentioned earlier, I'm here today with Dr. Susan Bissett, the president of the West Virginia Drug Intervention Institute. And so we talked a little bit about how you were at UC when this position came available, but you've shared with us multiple times in the office an event that occurred there that kind of also made you feel like this was the field that you really needed to get involved in. And I don't know if you feel comfortable sharing that, but if not, how have some of those past experiences informed the work that you do today?
Well, I've talked about before, and I don't necessarily like to talk about where or who because I want to honor the family. But I did have an unfortunate experience during my tenure in higher ed of responding to an overdose, and the individual did not live. And there was not Narcan available, and that had a profound impact on me. At the time, I was already doing outreach in the community, not only with students going into schools talking about medication safety, but when we had a syringe service program at the Kanawha Charleston Health Department, many of our pharmacy students were what we call precepting there or on rotation there, and I would go down every Wednesday. And initially, I just ran folders. I would come get the clients from the room and bring them back into the rooms where they were receiving treatments, or we were asking them, we were doing screenings for opioid risk, or where they were at in a disease state. There was a lot of HIV testing and Hep C because those go hand in hand, unfortunately, with drug use. And then one day it just got so busy, and Tina Ramirez, who is now at Marshall Health, also a very good friend to the Institute, it was so busy, and she was running the program at the time, and she looked up and said, "I need you to run a room." And I sat in a room and did the screening and worked with the exchange program and dealt one-on-one with the patients that were a part of that program. And I think that also had a profound impact on me, because you realize, when we talk about stigma, if we're going to unpack it, we all have prejudices and we all have thoughts in our minds about what certain things look like, right? So you think drug use looks like X. And I've talked about this before. I grew up in Detroit. And I grew up in Detroit in the 70s and 80s during a very, very different drug epidemic, crack. And my mother was a neonatal nurse. And so my mother knew what neonatal abstinence syndrome was before anybody ever labeled it that in the research or the medical journals. And she would come home and talk about it. And so that impacted me also as a small child, because I saw my mom lose a lot of the babies that she was taking care of. But I think having these experiences, I was like, these women are like me. These kids could be my kids. It could be my coworker. I mean, it just, those experiences, the experiences of losing somebody that I knew, who no one had any idea that this person was using. They seemed to have everything together. I mean, it was a shock to everybody. And then to go to volunteer at the harm reduction in the syringe service program and to see that this truly can happen to anybody. I mean, we had in that program, families coming in together. And that just profoundly impacted me, and I think it really made me more driven to do this work. And then I feel strongly that if we are going to better our state and our country, part of that is we have to make sure we have healthy people and a healthy workforce. And so that's part of what also motivates me too, I think.
And you didn't mention it as part of the accomplishments, but when you talk about, naloxone wasn't available and the Institute's now been able to train 30,000 people, that's a huge number, which is just fantastic and just proves again the hard work that you and your team have been able to accomplish. So in this work, which is definitely different than higher education, what do you think has surprised you the most, and what has maybe been the biggest disappointment?
Wow, those are tough questions.
I know.
Gosh, Heather, those are really, really hard, and you could tell I didn't think about it before we came, but I think for me, the biggest accomplishment has been twofold. One is with the medication safety piece and the fact that we've been able to reach so many kids and so many families, and that now we have kids that 3 and 4 years ago saw the medication safety program that if you showed them a picture of Rex the RX, they would be able to tell you who that is, what that is, and what that's about. And that's important to me because they've retained the information about medication safety. And it's a little different than other prevention programs because it is so focused on medication. And because this whole epidemic started with prescription medication, but now we have college kids that are taking prescription or counterfeit Adderall and unfortunately overdosing with counterfeit pills. And so that education has become even more important. So I'm very, very proud of that. I'm always surprised when a kid recognizes Rex.
It's great.
It's awesome. I love
so
to see
great.
that look and the eyes light up. And then I think the success of the One Box is really one of the accomplishments that I'm not surprised by it. It's a great product. Joe put a lot of thought and intention into how he created that, assembled it, manufactured it. But I've been surprised at the response from across the country. We have communities that are deploying 500-600 of these in every place in the community, and they're starting to collect data on what kind of impact that's had. So that response has surprised me. In terms of disappointment, I don't really have a whole lot of things that are related to the Institute that have been disappointing. There's hard days.
Yeah.
I remember one in particular. We had a really, really great day at the Institute, and this is how, I don't even remember what it was. I just remember going home to my apartment and feeling like I was on cloud nine because maybe it was a grant, I don't remember. It was something great we got that was really going to help a lot of people, and getting a phone call that somebody I knew had passed away from overdose on that same day.
Yeah.
And those are the days that are hard. Those are the days where you're like, am I just pushing the rock up the hill? But I think the rock's worth pushing up the hill.
Absolutely.
The lives are worth saving. We can't get people into recovery if they're not breathing and alive. And that's what naloxone and the One Box has been able to do. And so I look at things as bookends. We've got the prevention end on this side, and then we've got the overdose response on this side, because we want to stop this side from ever needing these services. And we don't actively do treatment, but we certainly work to try to connect people to treatment when needed. But we can't do that if we don't have them alive on this end of the bookend. So.
No, I would agree. So what is it about your role or just working in this field that keeps you optimistic for the future? Because as you said, this can be a very difficult field, and there's days you go home and just feel mentally and physically exhausted. What inspires you and makes you feel optimistic for the future?
I think the personal stories that people share of recovery are so huge to keeping me motivated. Recovery does happen, and people who are in long-term recovery are doing fantastic things across the state and for this country. They're the ones that are underneath the dome, educating our legislators about why some of these issues are important. They're the ones that are the peer recovery support specialists who are working one-on-one with other persons who are struggling with addiction. And so those stories are what really, really keeps me me motivated. And then to hear youth, you know, who talk about making good choices, walking down a good path, but also helping each other along the way. And I think those are the things that motivate me.
What do you enjoy the most about your work at the Institute?
My team.
Yeah, I was about to say, we have a
My
great
team. We have a great team. We laugh. We work very hard. We're mostly women.
Yes.
And so we have a good time. We have a good time. Some days we're exhausted, but we try to motivate each other and keep each other optimistic. And so I really enjoy my team. I enjoy my board. They're very active. They're very responsive. Not every nonprofit leader can say that about a board. And so I think that's important. So those are the things that I enjoy the most.
Yeah. Any events or activities coming up that you'd like to share with the viewers? I know that just this week we had a premiere of a documentary that the Institute collaborated with West Virginia Public Broadcasting to produce, but any other events or activities coming up that you'd like to share?
Oh, there's so many things, and we might not have time to talk about them all, but we always do Drug Take Back in April and October. We're getting ready to have a small celebratory luncheon for 5 years of the Institute. I'll be speaking in Florida on a panel in the next couple of months. I'm getting married in June.
Yes,
that's a big event.
deal.
Can I
That's
say
huge.
that?
Yeah, of course.
So I'm really excited about that. That's a really happy thing. But we have a lot of stuff happening at the Institute, and you know, we're very proud of the documentary, and that will be airing and streaming on PBS and their YouTube channel, their website, and then also, of course, online. So we're excited about that as well. And then we'll be doing Overdose Awareness Today, and you will be seeing us in some capacity at Healing Appalachia again, too.
Great. So much going on.
Yes.
So much. Calendars stay very full at the
Yes.
Institute. Anything else you'd like to share with our viewers, or any last comments before we close for today?
I think the main thing that I would share is that I think what's most important to this work is compassion and understanding. You know, I made the comment early on about listening if you're new to this field, but I think all of us could do a little bit more listening on the day-to-day basis and really hear what people have to say, and that's what their experiences should help to inform our work. And so, you know, our folks in recovery like to say nothing about us without us, and I think that's a very powerful statement and is very true in this work.
Well, thank you so much, Susan. It's been great to sit down with you in this capacity and you be there and not me. So thank you again for joining us, and we'll see everyone next time on Healing Our Communities.